So, next topic, big one, apps. Apps, like I just hear about them. It's exhausting to hear the word app anymore. But especially when it comes to healthcare, I think it's even more fascinating because, you know, when we wrote the title, I actually think it's quite applicable. Is an app a day keeping the doc away? And what happens is we're talking about engagement, we're talking about long-term use, and ultimately effectiveness. And so just creating an app and putting it out there on the App Store isn't going to cut it anymore. And apps aren't only those apps; they are connected to devices and all these kinds of different things. So. Hence, what this session is really about. I was fortunate to meet Dan Munro last year here at CES. I remember it was right over there. And Dan works for a small little publication called Forbes. He's a contributing editor there. And he focuses mostly around the intersection of healthcare, IT, innovation, and policy. And it is it's a true passion of his every time I talk to him. So one quick fun fact about Dan. To him, being a reporter, everything's off the record. So I'm just going to say this to you right now. This entire session is off the record. Thank you.
I'm Dan Munro. I do write on the healthcare space for Forbes. And I welcome everybody to come up there and read. There is a passion there that I have, and I try and bring that to what I write about. And as it turns out, I do actually have a software development background where I did heads down software development for IBM for 4 years. So when Jill was looking through the program and I saw this, I said, yeah, man, that's my wheelhouse because I love software. And I'm in the same camp as Mark Andreessen, who earlier, or late last year, I guess, wrote the headline that said software is going to eat the world. And so that's sort of in my wheelhouse. But obviously there's a marriage between, especially in healthcare, there's a marriage between hardware and software that we have to deal with. And it's some of the polarity that we want to talk about today relative to applications and how they're being used in mobile devices and digital health in general. So it's a great panel. I'm going to let them introduce themselves in part because their bios are certainly all in the program. But what I'd like to do is to have each of them take maybe 1 or 2 minutes and just talk about what they're seeing for their own company or their own alliance organization and what they're seeing on the roadmap for 2013 because it's being chartered as such a pivotal year. So let's start with John DeSouza as the CEO of MedHelp.
Thank you. Just a couple of words in terms of what we do. We've created a platform to drive consumer health engagement. We go and try and figure out how to get people engaged in the health, doing a few different things. We connect users with communities. We have the largest online health communities out there. We connect them with doctors, with partnerships with the Cleveland Clinic, National Jewish, Johns Hopkins, and we have a full panels of apps and tools that people can use to track their health. You can do it on our own site, medhelp.org. We have over 100 million people a year coming to the site and doing that. And we work with many of the large health plans or retail pharmacies to drive engagement on their own site. When we look at 2013, we have 3 things that we're spending a lot of time on for 2013. The first is data enlightenment. We spoke a lot about a lot of data being out there, but taking that data and actually making it so that it makes sense to the user is something we're spending a lot of focus on. The second is online and offline integration. We do a lot of stuff that's online and mobile, but we're doing more work right now in terms of partnering with people who have offline channels so that people can find out how you use that online data if it's when you see a doctor offline or you go to a lab testing company offline. So there's that online-offline integration that we're spending time with. And the third is with mobile transactions. We get a lot of different types of transactions online. Mobile transactions have been more challenging. And so we're doing a very deep dive focus for this year, saying how do you get those mobile transactions to work well?
Perfect. Benjamin Sarda is the head of marketing for Orange Healthcare in France. So it's more of a global view relative to the mobile app space.
Okay, thank you. I'm really glad to be here with you. Orange is a French company, but we have a worldwide activity, and it's true also for Orange Healthcare. I think in the coming year there will be 2 major trends that are going to change the deal. The first one is I think most of the players on the e-health field used to have very wide strategies saying, okay, I will build end-to-end solution alone. I will do software, I will do the device, and so on. Some of them are still there. More and more people agree that we need partners, and more the value chain and the way we will break it down is clear to all the players. This is the first thing. The second one is about Europe. Most of the countries were facing troubles with chronic disease. They don't have reimbursement scheme to enable connected device management and chronic disease remote management. These are starting to change last year. So in the coming months, we will see in France, in Germany, in UK, a real shift in the way we can address chronic disease remote management. And apps are part of the picture.
Perfect. And then Stanley, Stanley Yang has Neurosky, and I had a chance to actually try the demo. This isn't his product per se, but the technology that drives the demo was just fascinating because it's using brainwaves now to control devices. And so the demo that I did was where you wear a headband and you're able to control, just using brainwaves and focus and attention, just using brainwaves, you're able to control one of those remote control helicopters. So there's a very, obviously a very strong correlation between how that works, and obviously that's Stanley's company. So, Stanley Yang.
Okay, so at Neurosky we built these biosensors that detect your brainwave, like Dan said earlier, as well as your cardio signal. So we focus on both brain and heart, the two most vital organs that in the human body. And we collaborate with a lot of partners and customers out there to create these products. So with today's topic, it reminded me, by the way, I'm holding in my hands a collaboration with Stanford Medical, for example. Earlier this morning, Dr. Fitzgerald, in one of the sessions, he was a moderator, and they're giving these or providing these to their patients to remotely detect their heart health after treatment and stuff, using our sensors. And that's an example I'm trying to talk about here today. It was also mentioned this morning, for example, with the new Obamacare, there'll be 30 million more people on the healthcare system. But somebody didn't do the math right. Without increasing the number of doctors and healthcare professionals, that means if you average them out, each person is going to have to work an extra 6 hours a day just to take care of these additional patients. So some technology and some kind of tool is going to have to be mixed into this whole thing. Otherwise, the traditional way of helping these people will be nearly impossible. And that's where we come in, and a lot of these good folks here in the show come in. It's trying to provide technology. And today it's called an app a day, keeping the doctor away. I think it's not keeping the doctor away, but it gives you another way to connect with your doctor and without spending a whole lot of his time, and making sure that you're okay as well. So that's where we are, and that's what we do. And we have a booth in the South Hall. You can go experience some of these.
Yeah, absolutely. Try it out, because it's absolutely amazing to watch and feel and see. Behind all of that, I talked earlier about the polarity between hardware and software, and how obviously those two things have to work together, and they have to work together quickly, and they have to work together with standards. And so we have to rely on organizations like the Continua Health Alliance to help us navigate that. And so representing that group is the executive director, Chuck. Go ahead.
Sure, thanks, Dan. Yeah, so many of you know who Continua is. We've been here and working in this area for a little over 7 years now. But the important thing is that we do is it's not sexy, but it's required, and that is that we need to get the standard set, and so that you have that interoperability. So you make it easier for the plug-and-play capabilities for the consumer to be able to hook these devices together, because truly, we can't provide technicians to everybody out there in the field. So some of the things that happened for us in 2012 is that we now started to see country uptake of the Continua guidelines. So Denmark made a formal announcement in August of this year, I'm sorry, now it's 2012, that they were going to use the Continua framework for their interoperability requirements for deploying tools to their home at this point. So we're now starting to see large-scale adoption with this organization in an entire nation. And they are one of the leading organizations for healthcare. We're also seeing that happen in other parts of the world as well, in Abu Dhabi now, as well as Singapore, who are looking at doing the same type of announcement, using this framework as their model forward. So we're starting to see some success. These models and things that we've been working on for 6.5 years, we're now on level 5 of our guidelines. So we're really at this point starting to shift away from where we started, which was at the time PCs, and now move this more to the mobile side as well. So we're starting to see some exciting new mobile capabilities where we're standardizing that process and making sure that these devices can work with the plethora of tablets and phones that are now coming into the market space.
Excellent. So at this event last year, the keynote was actually John Scully. And I lifted one of the quotes from the event from John, and I thought I'd reference back to it because it's a great lead-in to a comment that he did make, and it's a part of the record. So he said, in effect, that from his vantage point, digital health today feels very much like the PC industry of the 80s. And so that's obviously an exciting time, but it's also a challenging time in the sense that it was chaos. There was a lot of chaos, and so that's also an opportune time. So what I wanted to frame was how that applies to 2013 going forward, because a follow-on was a fellow Forbes contributor who wrote the headline that 2013 is the year of digital health. So are we in the year of digital health? Does it feel to you guys that are in the trenches with this, does it feel like this is the PC industry back in the 80s? Because some of us are gray-haired enough to where we did live through that. So, John, I'll start with you.
So I think, being a new, one thing we should do is we should take the time to celebrate what we have achieved. And I think in health we have this tendency to beat ourselves up without looking at what we have done. So even if I just look at 2012 for us, over the year we had over 100 million unique people come to our site and use digital health. Of that, 70% were from the US. We had over 70 million people from the US use digital health on our site. That's a pretty impressive number to go there. We have right now probably about 6 million people tracking their health. They've entered over 100 million data points out there to track different perspectives. So I think there's a lot that's already happened out there, and that's very impressive, and a lot that's going on. I think as we look about the year for digital health, it's an interconnected system. So I don't think there's one year where any one spark. I think there are many things that need to get in place to get there. For me, what I really want to see is when every doctor, as soon as you see them, shows, let me see your data. For me, that would be the big, because as soon as that's sort of a natural thing, I'll say we've achieved it. There's a lot of steps we need to go there. And I think we're at a point right now where a lot of people are using it. There's a lot of good they're getting out of it. But the doctor needs to be pulled into it to achieve it.
Yeah. Benjamin, you have a great view of this relative to a larger, more global view than certainly here in the U.S. We have a tendency to be a little bit myopic about what's happening here in digital health in the U.S. Yeah. Help us understand how that's happening in other parts of the world.
Well, I think we might be on the top of the hype curve. I'm not sure that we are not going to face deception or disillusion in the coming months, especially because I think today that there are, as you said, it's a wide area, it's a wide market. And some part of this market are really mature. And, well, for example, if you take what's happening inside the hospital, today we sell a solution for cloud medical imaging, and it's really industrial, it's great scale and so on. So this is a mature market. When it comes to, for example, prevention and wellness, it still doesn't fly. We don't have real business models there. So we really need to break down the entire e-health ecosystem and the entire e-health market to say, okay, this part is mature, and we are facing the end of the 80s. I don't remember it, but well.
You'll trust us.
And some other parts are really in earlier phases, I think so. And to be complete, I'm talking about Europe. I think in the United States, the mix between real healthcare solution and prevention and wellness solution might be a problem too in the coming months. I think for other regions, we work a lot with Africa. We start to have really industrial and comprehensive solution to enable access to health in, well, some of the poorest country in the world. So this might be more mature than we believed it was last year or 2 years ago.
From my standpoint, we are seeing much more interest in digital health using our technology. I can't speak for everybody else's. Outside the country, outside the U.S. First, and then inside the U.S. Not that there's no interest. In fact, there's a lot of interest in the U.S., but there's just too many regulations and too many obstacles, and as well as perhaps some market share grabbing and fighting there, that it makes the market not as clear to me, like who to go after and who's driving the driving force behind it, compared to certain countries where there's a government supporting behind the whole thing with agencies and carrier, cell phone carrier supports. This is a whole system. It's pretty straightforward. So I would say this is a year of digital health, but it also depends on whether in each region how the governments, how the big organizations and the people in each location supports it.
Chuck, in your case, we're still living with PC versus Mac. We're still living with iOS versus Android. We're still, so from that perspective, are we in the 80s? Is this a revisit of that?
Yeah, and I'm one of those that actually did live through those wars. So, yeah,
you and me both.
And I would say that, there's as you just heard, I think it is really truly sort of a qualified yes, depending on where you are in the world. So we operate on an international scope, and so we're really working on some of our activities in China, in the Southeast Asia region. Obviously, as I mentioned before, Denmark. Those are countries that are moving forward with the adoption of this type of technology, because in some cases in China and India, they have no other way to deliver healthcare. That's the only way they're going to be able to reach the masses that they need to. So there's a real investment there in to try to reach that. But in the U.S., I think that we're still on that uphill climb, and there's a couple of reasons for that. One is, meaningful use, which is part of the ACA legislation that hit. Meaningful use is the rewards for physicians to pay for their adoption of technology, and physicians get X number of dollars for reaching meaningful use level 1, meaningful use level 2. Meaningful use level 3, which doesn't actually start until 2014, is the one that really considers and contemplates patient self-reported data. So there's a lot of confounding factors that are probably slowing that adoption, to your point that you've heard here already, in the U.S. These healthcare entities are really focused at this current time on the EHR adoption side of that battle. So we're still trying to progress to that point of getting to that, what we consider to be meaningful use 3. So I think in the U.S. it's a qualified, we're on that hill. On the consumer side, I think that we're starting to see adoption already start to happen, but on the medical and clinical side, I think it's going to take us a little while longer, because it's, they're still focused on trying to reach those other dollars that are in front of them right now at this time.
Great lead into the next question, because just going through some rough statistics, Apple announced this week that they have now downloaded over 40 billion apps through their App Store, and that's based on a number of roughly, I think it's about 800,000 actual apps that are available. This is just Apple and just the iOS store. The challenge for us in healthcare is that I don't know that we have numbers relative to actual downloads. I've heard 44, 45 million in the healthcare space relative to downloads, but I think the actual number of applications in the healthcare space is 15,000. So the challenge on the consumer side is that it may be saturation in terms of sheer volume, and the question then on the consumer side too is they may be downloading these apps, are they actually using them? But that also plays to the clinical side in the sense that the doctors are very supportive, and they're very anxious with iOS and these devices to bring them into a clinical setting, but there's a lot of risks and there's a lot of security issues associated with that. Do we have the right balance in the sense of focusing our efforts towards consumer applications versus clinical apps? And should we be focused more on one area than the other? It seems like there's an awful lot of attention on the consumer app side and not enough on the clinical side. So you're grinning, so I'll go right back to you.
It's regulatory in nature. I mean, I think
Yeah.
that's really the major component of it. The consumer side, you don't run into that big scary word FDA. And so I think that, there's a lot more emphasis on trying to bring those apps to the market space. And that single interaction of being able to download that one app at 99 cents is fairly interesting to most business models now, because you can see significant amounts of downloads and really gain that activity really up front relatively quickly. But on the medical side, you run the risk of running into the FDA and being classified a class 1, class 2 device and having to go through that regulatory aspect. So I think while we are seeing that happen, there are risks involved in business models because you have that delay of having to go through potentially a certification model.
Yeah. Business tension. You're working at a very, the clinical level that you're working at is fundamentally really, really dynamic and challenging, I would imagine, relative to regulation and clinical use, which is where we need to get to with the technology.
Yeah, I divided the company in 2 sessions. One's to deal with general consumers. We call it the fitness session, where there's not much FDA requirement. Same technology, but you can't reveal as much. And the other one, we collaborate with hospitals, for example, Stanford, to go through the FDA route and get to the approval level that satisfies the system. And last year, and I totally agree with you about the FDA. Last year I had to deliver a speech in one of the FDA sessions, and I called them and offended the entire crowd by saying FDA stands for Fun-Deprived Americans, because they are
Say that again.
fun-deprived Americans.
Fun-deprived Americans.
They have no sense of humor and everything's serious, and just can't push
Oh
anything
yeah,
through.
yeah. That's the FDA.
Yeah, and that's what I have to, a portion of our company have to deal with.
Right.
And accordingly, I hired a bunch of people with no sense of humor as well to deal with them.
It's an interesting business solution. So you're seeing some of this as well. Is on the in that realm, are the doctors in France, are they more engaged with clinical apps than on the consumer side? Are the consumers there as eager and as excited about these kinds of apps?
No, they're not. It's
Okay.
even less than in the United States. I want to add something here. You have really 2 different markets. When it comes to consumer, when you're B2C, really it's about wellness and prevention. You can't have something that will integrate somehow the care cycle. It just doesn't work. So the requirements from your customer are really about being able to share their data, to be open, to be fun, available on the internet, and so on. When it comes to the clinical side, you must be HIPAA compliant. In Europe, we have other standards, but it's the same. So it's basically about security, integrity, and, well, it doesn't really fit together. And at the end of the day, I think that the players that are going to make a lot of money from the healthcare part of the e-health ecosystem are really not the same than the ones that are going to make money from prevention and wellness, because it does not rely on the same kind of assets, basically. And to come back to your question, I don't believe that it exists something like patient-led revolution in healthcare. I mean, even if I have a great software with a great device that is able to collect everything that is inside my body, saying, okay, your heartbeat is this rate, your pressure is that, and you had too much of banana, I don't know. I will come to my physician saying, okay, I got this great app on my phone, please use it. It will just take my phone and say, okay, just click on my scale, and then I will take your blood pressure, and so on. So basically, there are no patient-led revolution in healthcare, because physicians, doctors must feel that the data they're working with are really good data.
Trusted data.
Trusted data.
Yeah.
And this is one of the reasons. Other reasons are about legal issues, liabilities, and so on. So I think it's really important, and it might be one of the best events in 2013 for e-health ecosystem. I think people are starting to really understand the split between these two markets, and people are choosing one of them. I think you can't do both.
Right. But now, John, you've seen significant traction. You referenced 100 million, I think.
So I would say I actually do think there's a patient-led revolution in healthcare, and I see it every day. Online, we had this father whose, I think it was a 6-year-old son, was going through cancer and eventually put into hospice care. They told him he had a few weeks left to live. A couple of months later, child is still alive. They're not sure why. He's doing all this research online and connects with other family that had a similar types of cancer, connects with a doctor, and they find out they're treating the wrong type of cancer. It was not a fatal type of cancer. They were treating the wrong type of cancer, got him treated, child is recovering. I see this all the time. I went with my father to the ER. He had, where his tongue swells up, angioedema, and they're there saying it must be an allergy to food, treating him for it. I'm checking online. Somebody tells me, is he taking Lipitor? I go, yes. They go, check, it might be an allergic reaction. I check, and they go, yes, it's probably allergic reaction to Lipitor. I see where the patient is starting. I'm not saying you're disintermediating doctors. You're working with doctors to get to better outcomes, and it's going to be led by the patient. So I think there's a huge amount of work that can be there, and I feel very empowered when I go into a doctor right now. I feel as if I have a lot more tools to go through and drive it. And in terms of the clinical versus consumer, they're different. I think you have a lot of clinical apps for doctors to extend the EMR, which is important. I think to be able to get doctors to effectively use data that the patients have, you need a way to make that connection. And the problem right now is the EMR companies are too busy deploying EMRs. They don't have time to do anything else. They're making too much money doing that. And then when you have the meaningful use, it's the minimum requirement so that you can check that box. If you can say, we've just put something where you can download a PDF file and checks the box, that's all they'll do. So we need to get it where it actually is a meaningful requirement to connect. It can't just be check the box and you're done, you get the money, move on to the next. So I think that is what I'd love to see is for them, somebody who's doing the EMR, to make it easy for the doctors to see this data in a way that they can actually use it. And I don't see that happening at all.
Yeah, I just want to follow up on the FDA comment, though. I think that, while we see that the FDA has been sort of a major player, and certainly in some cases, really rightfully so, scared a lot of companies in this case, what we find as a trade association here, working with them very closely, is that they now have been actually able to engage. We've been able to engage with them directly. And we did that in 2010, and it led to the last year, they're at least issuing their mobile medical apps guidance. So they're actually taking steps to recognize that, and also over the last year to create a new internal agency that's focused on this as well. So they're moving, obviously at governmental speed, but they're moving, and I think it's a positive thing for us, though, at this point, so that they are recognizing that this world's challenging to them and it's changing beneath them quickly.
Yeah. So let's talk about the consumers just for a second, because there is so much interest there, and there is a lot of activity there in the sense of software developers that are trying to bring new solutions to help us with our healthcare life. We're also at the end of what we affectionately refer to as list season in the journalism world, because it's the end of year, and so you get all these end of year lists, and then you get all these predictions for the new year. One of the lists that I saw towards the end of last year was the world's greatest 100 apps, and it was like, oh, okay. So I scrolled through, and of course my eyes, I'm always looking for the healthcare ones. And it took me to get to number 87 before there was a healthcare app, and it was the only one, and it was Nike Plus. So where are we relative to engaging consumers with applications using mobile devices? There's an awful lot of interest and activity in the area. Are they engaged? Are they engaged at scale? Should we continue focusing in that category?
So I'll take a couple of different cuts at that. The first is you hear a lot of people with health apps that say, people aren't using them. If they're not using them, you probably have the wrong product for them. And I think you need this maniacal focus on consumers to get apps that people will use. It's often this is what they should be using, but it doesn't often get them to use it.
Yeah.
And so I think people make that confusion. I'll show you a simple example. You always get, well, people use apps for 3 months, health apps, and then they stop using it. So we went through and started iterating very rapidly on that, trying to figure out how do you solve that problem. And we came up with a very simple thing that actually transformed how we collect the data, is we told people, track whatever you want, whenever you want. Don't feel the pressure to track it every day. If you want to track it once a week, great. If you want to track it for a week and then come back 6 months later, do that. What we found out is it takes away anxiety. People have anxiety from having to do something again and again for the rest of their life. If you take away that anxiety, they don't feel that pressure of, if I go in, I'm going to see this blank that I didn't track it for the last 3 weeks and then they disappear. They come in, they go through, and if that becomes their MO, then they're willing to go through and do it. So you have to start out with, how do you work with them to make it part of what they do so that they don't feel bad? And then you can get them to go through and use it. The other thing I'll say in health is, people want the one app that a lot of people use, but what we find out is you need a lot of apps that are very specific to conditions, but they need to interconnect. And so people may want to track food for a while, they may leave it. They may want to track sleep, leave it. The data needs to be interconnected, and that is good enough, because then you can get that longitudinal analysis of their health. So I don't think we need that one big app. We need a lot of small apps around health that can interconnect.
Benjamin, you've kind of said that the consumer maybe isn't as engaged in Europe for these kinds of apps.
Yeah, well, I will have the same kind of answer that for your previous question.
It's off the record.
Yeah. Well, since I don't believe that people will be able to download an app and ask the physician, ask the hospital to use their own app, I think app stores are not the good distribution channel. I believe in app. I believe that they can change the deal. But it's not by putting an app on the Apple Store that you will have the entire community to use it and to use it the right way. If you say, okay, I will build an entire system with partner, for example, to monitor your diabetes, and well, the app is part of this entire system. And as your physician, I will prescribe this entire system. And by the way, there will be an app inside it. I believe in such kind of organizations, kind of scheme. I don't believe that because you put an app on the Apple Store, well, it will change people's life. But if it happens, yeah, well, that's great.
There's the hope.
Yeah,
I think there's a lot of effort.
Yeah, I don't want you to be sad.
Yeah. So that's one of the reasons why you've sort of also split the effort and energy inside your company relative to the clinical side and the consumer side.
Yeah, my view is this. I think leveraging from your PC metaphor, back in the 80s when I was in junior high, I knew how to work with PCs and all that stuff, and my teachers didn't. And they came and asked me how to work and stuff. It was too complicated. Even though it was easy, because I studied it, so it was kind of easy for me, but maybe it wasn't easy for general public. So I was the de facto go-to guide. How do you run this program? How do you do that in the classroom? Same thing for the health apps nowadays. I think they're just too many, too tedious, and nobody knows what's going on. I'm not a doctor, for example. So after a few years of working, doing what I'm doing, I learned a few things. But at the beginning, I just want the device to tell me I'm okay today or I'm going to die tomorrow, whatever. And I don't care if it's blood pressure, this, and it's really not meaningful to an average person, and that's why the apps are not very popular. So if we can come up with parameters and apps and standards that standardize all this and be able to tell somebody, you're okay today, just go do your thing, or you're not feeling well today because of this, and you should, recommendations. Of course, that had to go through a lot of FDA issues as well. But that would be a useful health app, because most of us don't know. When my doctor tells me, you have encountered this and that problem, I would ask him to say, can you speak in English? Because I don't understand what you just told me. And that's what apps should do, especially you can tell the app speak in English. So I believe in order for a popular app to happen, it needs to be very simple, easy to understand, and it's meaningful to average Joe in order for people to use them.
Chuck, you're right. I would imagine most of your battle is sort of on the clinical side relative to the infrastructure there. Are there companies that come to you relative to consumer side and consumer apps?
Oh yes, certainly. So what we do covers all those fields as well. So really to your point, it's getting those connections together, making sure that we can plug and play them together. And I think we take a look at the app field today. There's sort of, we look at it in two different realms. There is the clinical realm. So those that a clinical professional is going to use or perhaps prescribe, and then those that the consumers are going to use. At some point in the future, you have to integrate that data because it's going to be useful to both parties. But I think we're sort of, using the metaphor that you've talked about in the PC wars and back in the 80s, we're sort of at that level now of we've just introduced MS-DOS. So we have some level of knowledge of how to begin to implement the technology.
You mean we have to live through Windows 95 again?
Yeah.
Oh my God.
But that's a good point, though, because I think we're sort of at that level 1, and level 2 would be, we didn't really see a widespread adoption of the PC until we got to Windows, and it made it easier to use. And it was that whole ease of use that really sort of pushed the next level of adoption of computers. And then, we saw that become a business tool, and then it became a personal. We all discovered, hey, I can do something else with this, and it sort of became de facto that we bought them for home purposes as well. And so I think that we're sort of at that level 1, and the apps themselves haven't gained all that necessary intelligence yet. They're still sort of just basically a good GUI for what the device is reporting to you, or there's sort of a slow feedback mechanism for what you're maybe self-entering in that case. It becomes more relevant when these apps start providing you intelligence behind what's going on, and they link you to other resources at level 3 that perhaps are your not only your personal physician or your healthcare team, but also those other individuals who you have an interest in. So, for diabetics, I need to link to other diabetics and find out what's going on with them across the globe. So I think we're still sort of at that early phase in the adoption. So that's why I don't think we've seen just widespread takeoff yet of any one single app.
I'm getting a signal that we got a couple more, maybe time for 2 more quick ones. I'll shoot them out anyway. But late last year, Eric Topol tweeted that for the first time he had treated a patient with what he called cyberchondria. So obviously somebody had gone a little haywire with their quantified self, which I can understand it. It's the human body has some interesting arrhythmias. So if you're monitoring those all the time, it can be a little dicey. And so the question becomes: should these apps, should they be certified? Should they be prescribed? And or obviously they need, in a sense, to be curated. But certainly the ones on the consumer side are getting more and more sophisticated relative to heart monitor, relative to glucose monitor, relative to other monitoring and censoring. So should they be more heavily regulated by independent groups?
Well, the FDA's already done that. So we saw last year where the FDA stepped in and killed, literally went after 2 apps that were on the iPhone market or the iTunes market. So we know the FDA has the regulatory authority to do that today, and actually took those steps last year. So I think it's good, though, that they're actually putting sort of this new model and steps out there that says, here's how we're going to define this. If you fall within these parameters, you're going to be a regulated app. Yeah. And so they're trying to clearly define for the market space what it is that, where that's going to hit, and if you fall in that category of, working with medical devices, providing some level of medical advice from your technology, you're probably going to run the risk of falling into a prescribed category of regulation.
Is that something that the Continua Alliance would look at in the sense of certification of apps?
We're not going to do the certification of apps. That's not something that, it's too subjective, if you will. There's not a lot of pieces yet to it's sort of a big moving puzzle piece at this point. There are companies that are stepping up to try to do that. We applaud those efforts. The Greater New York Health Association, with its subsidiary Haptique, has stepped up to at least qualify a new app store that allows them to basically plug in and have some medical apps that are at least been qualified.
That's another Ben question for Haptique. Should they be certified? Should we prescribe these, especially ones that are, wow, what they're doing with brain waves?
I have a bias because of my nature of my business. I want my sensors and products to be everywhere. In my opinion, for consumer electronics, the reason why we're enjoying such a big burst of technology is because there's not much of regulation, and whoever come up with the best technology and most easy to use wins the market. That's not the case in healthcare at all, in health at all. In fact, the cost goes up, and your choice is very limited because there's very heavy regulation into what you can and cannot do before an entrepreneur even throws in a dime or an effort into doing it. He has to look at the mountain of regulations that he has to climb if it goes that way. So my personal preference would be to deregulate it and see what technology can win. And you can use it like a vitamin, and then some of them, maybe your doctor will prescribe it to you, but I don't think we should have a whole lot of regulation on innovation.
Well, I think there are at least two markets. The first one is about wellness and prevention. I go jogging and I want to know if my time is better than yesterday. I don't think regulation has anything to do there. However, when it comes to the healthcare market, we want to provide the patient with something that is really reliable. And I think regulation has to do there. So I don't see it as a threat. Actually, I see it as entry barrier. But I'm a marketing guy.
So, I don't think that anything that allows us to collect information ourselves should be regulated. I think that's, if you're just getting data on ourselves, we should be able to go through and do that. I think we have to be very careful right now with the FDA saying if it somehow interprets the data, they may want to regulate it. So if your weighing scale now tells you that you're obese, it may be giving you medical advice, telling you to, if you're obese, you may lose weight and may be regulated. I think we'll be very careful about that because our biggest complaint is that we get all this data and it's meaningless to us. And then the next step could be, well, if it becomes meaningful, we need to regulate it, which means you're going to get no data. So I think we can very quickly go down the path of keep it meaningless and get nowhere. Yeah. So I won't be able to collect the data, and I won't be able to understand the data. And I wouldn't be very happy if it suddenly got regulated and I was prevented from doing that.
Last question, quickly, and we'll get to that, but last question because it ties in so well. Hugo Campus has been fighting the battle with, I think, Medtronic because he has an implantable defibrillator. And he's been fighting with them legally over, and it's a great question, right? With these kinds of devices and with these kinds of apps, who owns the data?
I strongly believe that you should be able to own your own data, and that the government should believe that you have enough responsibility to do what you want with that data. I feel very offended when people tell me, I don't think you're responsible enough to do what you want with your data. So I am very much, you should own your own data.
Me too.
Well, in some European countries, it's clear. The law says patients own the data.
Yeah.
Yeah, we're building apps for several countries that the patients do own the data and they can access it through their cell phone carriers anytime.
Interesting.
Yeah, we don't necessarily have an opinion on that,
that was a
particular
quick
aspect
one.
because we see it, the data is available.
The data is the data. Questions?
I've been sitting in on several sessions with makers of household gadgets lamenting that consumers are being stymied because there's a separate app for every gadget. Are we going to see the same thing in health, or are we early enough in the process that that can be avoided?
Well, I think that, for what I was just mentioning a bit earlier, I think that it's an evolution. I think that we're going to see that. And the reason for that is unless you have interoperability at the base level of that capability, you end up with these silos of apps. So, I have the Nike Plus is monitoring the fuel band or my running shoe. And you don't see it integrating with a blood pressure cuff at this point. So I think it's unavoidable unless we get interoperability in play. It's unavoidable to have that separate app capability at this point. Eventually it does go away, but it's just the maturation of the market.
Yeah, I have a background in technology, so, or actually, as a matter of fact, any market, if you look at it, when the market matures, usually you have the number one and number two player left over in that market. So I believe that we're at the very beginning stage, early stage of this health app thing. Once it matures up, I believe the choices come down to a few, just like the smartphones or cell phone. At the beginning, there were so many models, and now we're beginning to see them converging to a few models. I believe that will happen to the apps as well, and whichever popular will survive and the less popular will die. I think that's just the nature of the market.
The only difference with health is you have a lot of different conditions, and in the end you will have different apps for different conditions, and the power is the interconnection across conditions. So you could have 2 in 50 conditions. So it could be 100 apps and they need to interconnect.
I guess I have the last question for you guys. You guys have talked a lot about like sort of the barriers to something like this taking off. But isn't it fair to wonder also whether or not consumer interest isn't actually there? So couldn't it be that some of the people who have downloaded these apps or who check out these websites, the early adopters are people who are just crazy about their health, and that there is no like level 3 for people who are interested in this kind of information?
I don't know for you guys, but I didn't hear the question.
Well, I think the question is,
Could you repeat the question?
Yeah, sorry.
So couldn't it be that the number of people who are interested in this kind of information, who are interested in knowing so much more about their health than their doctors will readily tell them, is limited? That there's a very low ceiling for the kinds of people who would be willing to download apps or to find out this much information about their health?
Every time we have this debate at the company about where there's interest in it, I keep on saying, if I told you I was going to create a game where I would have a virtual farm and virtual animals and charge you money to be able to plant, plants and this, would you invest in that? That is Farmville. It's a $1 billion business out there, actually worth more than that. And what's interesting is the demographic of the people who play that are exactly the demographic of the people who control health in the house. So if you can get people to worry about virtual pigs, I've got to believe that people would care about diabetes.
John, Benjamin, Stanley, and Chuck, thank you very much.
Thank you very much.